It's your weekly video. Let's talk about how health insurance is driving up mass incarceration. Here's what I mean. So it can be really, really hard to get health insurance companies to fully pay for mental health care. There have been stories of psychiatrists, psychologists saying, hey, I have this patient who I'm treating, and I get a call from the health insurance company saying, when will their treatment be done? What's the end date? And I'm like, it's bipolar disorder. There's not an end date. This is an ongoing therapy. And the health insurance provider responds, well, you better pick an end date because at a certain point, our ability to pay for treatment is over. This is such a big problem that back in 2008, Congress had to pass a law basically saying, hey, health insurance companies, you have to cover mental health care the same way you cover physical health care. And the Affordable Care Act had to require that health insurance companies even offer mental health coverage. And yet, decades later, we're still in a position where this is a huge challenge. Health insurance companies have done things over the years like restrict which medicines they will put in their standard formularies that they cover, or keep really small networks of providers that it's hard for somebody to find a doctor, or reimburse doctors so little for care that they can't both stay in business and take health insurance. And the end result is that between 2019 and 2022, 57% of American adults who tried to get mental health care couldn't actually get it. 70% of kids who tried to get mental health care couldn't actually get it. Now, this has a huge downstream effect on our criminal court system, because in this country, what do we do when someone can't get care? We call the cops. Which is why we're now at a point where Rikers Island in New York, Cook County Jail in Chicago, LA County Jail, each hold more people with mental illness than any psychiatric hospital in America. People with severe mental illness are 3 times more likely to be in prison or jail than in a psychiatric hospital. This is especially painful because people with mental illness are actually more likely to be victims of crime than to be perpetrators themselves. But because we've created a framework in which it's nearly impossible for people to get mental health care, we're meeting that framework with policing and prosecution that treats mental health needs as if they are a crime.